Welcome. Thank you for taking time out of your busy schedule to join me for this webinar. Even though we're only going to be together for a short while, I promise to make this time well invested. I always schedule 90 minutes for these sessions just in case we need it, and I hope you've blocked off 90 minutes as well so you can stay with me till the very end. Regardless of whether your specialty is nutrition or herbology, I know you will leave our session today with information you can use with your very next client. One thing that I've learned over my years in the holistic wellness industry is that excellent healers keep learning. They know they don't know it all. So congratulations for being in that small minority who are continuing to learn, who want to be your very best always, and who always want to give the best possible to your clients. I'm really excited to have you with me. I do want to get to know you just a little bit, so I've got a few polls that I want to do right off the top. And so I'm hoping that you will participate with me in this. So the first question I need to ask you is, what holistic health training do you have already? Check off as many of those as you've got. And I am inviting you to just play all in. You'll get a whole lot more out of this session together if you invest 100% the way I'm investing 100%. And there's still a couple of you that haven't weighed in yet. And so I'd really like you to do that for me, please. Excellent. And anyone else want to weigh in on this? Again, the more you weigh in, the more you play in, the more you're going to get from this. Alrighty then. Thank you very much. So what we've got is that, there's a way for me to share this. There we go. There we go. All of you have nutrition background. That's really exciting. And about a third of you have herbology or homeopathy or naturopathy or do some kind of energy work or body work. Excellent. Thank you for playing in with that. I do appreciate that because, you know, the more I know about you, the more I can tweak this presentation to be exactly what you need it to be. I have two more polls that I want to do before we get into the meat of what we're going to be covering today. This next one is, what assessment tools do you use? Do you have an intake questionnaire? Do you ask questions and have a dialogue with your client? Do you have access to blood tests or saliva testing? Do you do tongue or pulse diagnosis? Do you biokinesiology or muscle testing or energetics? Okay, excellent. Excellent, okay, lovely. Everyone weighed in on that one. Thank you so much, really appreciate that. And let's share that one back with you so you can see who your fellow attendees are. Most of you use some form of a questionnaire. You all like to talk to your clients and have a dialogue with them. That is so critical when we're talking holistic, isn't it? Some of you have access to blood tests and saliva tests. Good for you. And some of you use biokinesiology or muscle testing or energetic testing of some kind. Nicely done. And last but not least, I promise this is the last one for a little while. Do you have any iridology training yet? If you do, is it the constitutional style? Is it the Jensenian style? Or you don't have any training in this yet? Ah, okay. These numbers look interesting. Okay, excellent. And you've all weighed in again. Thank you so much for that. Here's what we've got. Whoops, I wanted to share that with you. There we go. 25% have constitutional, 25% have Jensenian, and 50% of you are brand new to this and don't have any actual training in it. So welcome. Now, those of you who have constitutional, everything we're going to talk about today is going to use your language. Those of you who have Jensenian, I will translate into Jensenian, and you will see that there are differences between the Jensenian that's been taught for many years and the newer constitutional. And those of you who are brand new, I promise I will explain things as clearly as I can so that you actually will take information home with you that you can use today. Thank you so much for doing that. I truly appreciate it. It helps me to shape the information a little bit as we're going so that it fits you better. Now, there might be challenges that you might be facing in your practice, particularly since we are all nutritionists here and some of us have some other training as well. And with all of these challenges, you know, your schooling probably set you up for some of these and you're probably creating some of them yourself. Let's take a look at what they are. The first one is not knowing exactly where to start in your recommendations and how to set that therapeutic priorities. You know, we use these questionnaires sometimes, and they ask so many questions, most of which have nothing to do with our client. They really don't. Sometimes the amount of information we gather just muddies the water. So maybe you would like help learning how to find a starting point, and then how to create what I call a therapeutic priority sequence or a therapeutic sequence. And what that means is in that first appointment, you are able to map out where you would like to go for appointment 2, 3, 4, 5, 6, sort of a logical progression. So you have a starting point, and you don't necessarily have an ending point, but you have a clear vision of which pathway you need to be on with this client. The second challenge is that we often get caught up doing a ton of research and program development outside of our client time. And that's time that you don't get paid for, right? Because they've paid you for the time that you're face-to-face. They're not paying you for that extra 2 or 3 or 4 hours that you're spending on them. We often do this because we sometimes feel like we are being compared against the medical profession. And so we feel like we need to give so that we look good compared to the medical world. The fact of the matter is that backfires, and you know, that's how we were taught to do it in school, right? We were taught to write these case studies. And in that case study, we were taught to include everything that we would teach this client for the rest of their life to help them do the very best they can. And yet, that's not the reality of how a good client session runs. You might feel like you're giving really good value for the money you've been paid because you've spent extra hours, you've written out this report that gives everything, but really what you're doing is overwhelming your clients with so much information that they don't come back for after the second session. You've given them so much information that they either were able to grab the 1 or 2 pieces that they think they need out of this big pile of good stuff, or they look at all this information you've given them and they go, well, I could never do that. I'm not even going to try. I'm out of here. And in both cases, neither of you are well served. You end up having to keep looking for new clients, and they end up stuck with their health problems being exactly as they were because they've not made any changes. So how do I know what your challenges are? Well, I've been there myself. You should have seen how complicated the homework was that I used to give my clients when I first started out. Even with using Iridology, back then I was doing Jensenian Iridology, which is quite different from constitutional. No one back then taught me how to break the homework down into doable, non-threatening pieces. My first consultations, we'd schedule an hour, 3 hours later, we'd still be together. Right now, that's not useful. It's not respecting the client's time. It's not respecting my time. It's not helping anybody truly. And I've also interviewed a lot of nutritionists, herbalists, and other holistic practitioners, and almost all of them have been there too. So if you're there now, you are not alone, and you don't need to stay there. How many of you do things like this. You write massive reports that overwhelm your clients. You spend time outside of your appointment time doing research or writing reports for your clients. If you do that, just raise your hand for me, would you? Okay, yeah. Yeah, okay. So some of you do. You know exactly what I'm talking about, and you know, thank you so much, and you know that I know where you're coming from because I have been there. So who am I? My name is Judith Cobb, and I've been a holistic health coach since 1981, master herbalist since 83, nutritional consulting practitioner since 94, and in 2016 I added the natural nutrition clinical practitioner. So these are actually different organizations. This is with the IONC, and this is with the CANNP. In 93, I became a certified iridologist and have been practicing all these years and actually teaching most of those years and teaching even before then, as you'll see. But in 2016, I added the Certified Comprehensive Iridology Instructor designation from the International Iridology Practitioners Association. We call them IPA. It's just so much easier. I've been teaching wellness professionals since 1985. You know, back in 1985, there were not many classes or courses. We didn't have the internet. Phones still had cords, right? We're talking ancient history here. And I could see as I started to learn things that there was a need for this to be taught, for this to be shared. So I started teaching in 1985. I'm also the wife of one, the mom of 7, and the grandma of 7. And I've built my business while having and raising those 7 children, these 7 right here. And in the process, I've made every mistake you can make in starting and building and working in and promoting a holistic wellness business. I spend a lot of time and a lot of money, and I never consider something wasted if I learn something, but there were a lot of those courses and programs where what I learned was that's not how I want to do it, and I will never run a program that way, right? And so they were not great experiences, but I was able to learn from them. I've spent less money with great mentors and doing programs, studying and taking classes to learn how to do things better. So if I could teach you how to save time, how to save money and frustration and discouragement and work more efficiently, but still work with the integrity that you want to have as a holistic practitioner, would that work for you? If that's what you're looking for, would you raise your hand? Yeah. Excellent. Thank you so much. So you are in the right place then. I promise you, you are. So would you like to eliminate your intake forms? Except for your waiver and release form, you always have every client sign a waiver or a release form. I don't care who you are, I don't care what you do, and I don't care who your clients are. Every one of them signs a waiver or release form. I even have my mom sign one annually. Yeah, you know, it may sound bad. I love my mom. We have a great relationship, but you never know what could happen. And I think it's just important for even the people we love to understand in that waiver or release what our limitations are and what we are expecting of them. Would you like to start creating deep rapport from the moment you start the consultation instead of starting with looking down at that awful intake form? You've all been to a medical doctor at some point in time. I don't know what the doctors are like where you live. Here in Calgary, doctors, of course, have 3 or 4 treatment rooms in their office, and outside each treatment room there's one of those little plastic IKEA racks. The receptionist puts your folder there, or now actually they're doing it all on computer, right? And so back in the paper days, she'd put your folder there, your file. The doctor would lift it out of there, he would open the door, open the file, and be looking down at the file as he walked in. No eye contact. Right? You go and looking at file, what can I do for you today, Mrs. Cobb? Right? Now it's equally as bad because they've got the computers. They go in, they log on, they get your file online, and they're looking at the computer while they're saying, and what can I do for you today, Mrs. Cobb? That is not the way to start developing rapport. These practitioners who do that clearly have a great relationship with their computer, maybe not such a great relationship with their clients. So we don't want to be looking down or at the computer. We want to be looking at our people. Would you like to do a core assessment in less than 5 minutes, knowing the right questions to ask, how to prioritize what needs to be dealt with first, and to create therapeutic priorities list for future consultations? Literally 5 minutes. 5 minutes. Do you want to eliminate your unpaid homework time? What would you do if that time was freed up? Would you see more clients? Would you spend more time with family? Do you have another hobby you would like to spend more time with? And would you like to stop overwhelming your clients? I'm going to ask you again, if you want to learn these things, if you want to have these skills under your belt, please raise your hand. Kelly, you got it. Yeah, good job. Thanks, Carly. I love it when you jump the gun because you know exactly where I'm heading. Well done. Thank you so much. Appreciate that. You know, I've had students who were certified by other iridology schools, but they were never taught how to integrate nutrition or herbology with what they were doing. So years after being quote unquote certified, they still weren't using their iridology. And after a couple of classes, they didn't even get through the entire course with me. Well, they finished the course, but before they were getting the picture. And they started integrating what they already knew and started using it in practice. That was just fabulous. So I'm hoping this doesn't sound too good to be true, because it's really not too good to be true. It's absolutely true. I'm going to demonstrate this in a moment. We're going to work through some case studies. I'm going to show you how iridology helps you gather that base of information. It teaches you what questions to ask, and it becomes the assessment process. And because you are there face-to-face with your client, you're looking at them, you're talking with them, you're asking them questions, you are developing rapport in the process. I recently spoke with a practitioner who said that she had an intake form that was 20 pages long. I simply wouldn't fill that in. That is not my kind of practitioner. Lovely lady, and she probably does a lot of good. I don't know her well. I just interviewed her to gather research, but I wouldn't do it. I simply wouldn't. I spoke with another practitioner who said she had just spent 3 hours with a client instead of the one that she'd been paid for that had been booked. And there were a couple of things that, yeah, she was helping that client, but she didn't get paid for those extra hours. And, you know, if you're only charging $40 or $50 an hour and you're not getting paid for those extra hours, you're really only making $13 or $14 an hour. Even if you charge $150 an hour, but you give 3 for the price of 1, you're really earning $50 an hour. And then if you're doing extra research beyond that, you're earning less per hour, right? And ultimately, you've got to make enough money to live on. The other point was this client that did the 3 for 1 had a 3-page intake, and at the end of page 1, her client complained about how much writing hurt her arthritic hands. Client torture, it's not what we should be doing, right? We're not here to abuse our clients, folks, not at all. So we're going to start playing with iridology now. I'm betting you're ready for that. You're hoping I'll get on with it, right? Now, here's the deal. A lot of people think they need this to start doing iridology. This is my most recent iridology camera. It is about $3,000 worth of equipment. You may or may not have that sitting in your back pocket. And if you do, great. I'll teach you how to get one of these. It's super easy. You can buy the camera body, the Rebel T6i, at any good camera store, and there's tons of Christmas sales on right now, so go grab that. You need a 60mm macro lens, an EFS macro lens, which you can also buy. They'll be on sale this time of year. Between these two things, you're probably going to pay about 1,400 Canadian, which will be probably about 1,000 or so US. This is what makes this an iridology camera. This is the IE4 from Iris Labs, and it comes with 2 adapter rings to give you the exact length you need here. This is worth, in and of itself, approximately $2,000 Canadian, which is about $1,500 or $1,600 American. Okay, so if you don't have that much money in your back pocket just waiting to buy a piece of iridology equipment, that is perfectly okay, because this is where every one of us started. This is what you need to start learning iridology. You need a good magnifying device. This is an 8x jeweler's loupe. And you need a good pen light that shines a really white light. Now, I also like to have one of these available, which is a lighted magnifying glass. I got this one on eBay just recently, actually. It was a great little toy. Comes with 3 different interchangeable magnifying glasses for it that are different powers. Ideally, you want to have a 10x and probably a 5x is about, you know, if you're going to get 2 lenses, that would be good. And with this and this, you can see 90% of what you need to see in an eye. There are some really fine markings. We're going to look at some of those today where, yeah, having one of these babies would be a great thing because you can see things that you never thought existed. But for a handheld, these are where we all started. So for under $75, much more affordable as a first step, that is where you start. I used this kind of equipment for about the first 5 years of my business. Nobody minded. They were perfectly fine with it. Okay, so why do I like 2 different setups? This one, the light is fixed. You cannot change how the light is going to cast shadows. It's always in the same position in relation to the lens. Sometimes we want to cast shadows in the eye because it makes certain features pop and become really visible. That's where having the 2-piece setup works so well. I can move the light around to where I want it to be so I can cast shadows. So I'm going to want, you know, that 5 or sorry, that 8 or maybe a 10x magnifier here. Now, if you've got this with interchangeable lenses, you only need this, right? Because if you've got 2 or 3 different powers here, you don't need to turn on the light. You can just use your flashlight if you want to cast shadows. So we've got lots of different things that we want to be doing, and we want to play with the equipment. Well, let's start playing. You ready? Let's start playing. Case number 1. Remember, with constitutional iridology, the iris itself shows us the genetic predisposition of the person. What we see in the iris is 90 to 95% what the person inherited from their parents. The fiber structure, these little threads in here are the fibers. The fiber structure stays the same. It doesn't change. And so as we look at this, we are looking what the potentials are for this body. Now, these are the eyes of a 4-year-old female. Darling little girl. Using iridology with a young child is a great opportunity for you to teach the mother nutrition as it relates to their child. It gives you the opportunity to ask questions and to get answers and to help that mother or that father create the optimal nutrition for the child. Now, what is the one thing that you really want to be careful with when you're working with a child? And I want you to type this into your questions box. What is the one thing that you need to be careful with if you are asking questions or giving information to a parent? If you've worked with parents, you'll understand this. If you are a parent, you'll probably understand it too. What do you think you need to be careful of? Lightning fingers typing away madly. Ah, Rita, yeah, you're totally right on. Not to scare the child or the parents. Because we all as parents, our minds go to that really bad, oh my goodness, my child is dying place before we stop to think about what's being said. So be very careful how you word things and how you look at things, how you say things, the questions you ask, because you don't want to scare your parent. It's not a good idea. Okay, let's look at the eyes close up. This eye is her left eye. Now, it looks like her pupil is really misshapen, that it's very oval, very vertically oval, and it's not. At 4 years old, for a child, even for adults, to get the idea and do it well of looking straight ahead into the lens, it's really a hard concept. So we couldn't really get her. With one eye we could, her other eye we couldn't. Tells me which eye is her dominant eye. And so when I would say look straight ahead with this eye, it wasn't going straight ahead. So she's slightly off to the side, which makes the pupil look oval. And so as we look at this, what we are seeing here is we are seeing the beginning, we see what we call osseous netting. Now you see that most of these fibers start at the edge of the iris, they come in, they do a hairpin turn, they come back out. But you also see that we've got some fibers that are just kind of all over the place. They are not starting at the edge, going towards the collarette and turning around, going back. They are meandering about, doing whatever the heck they want to do. That is osseous netting. Now, osseous netting is pretty hard to see with handheld equipment. Just saying. So if you don't see this when you're looking at a client's eyes, don't worry about it. It's not that you're blind. They may not have it, but it may be that 10x is not big enough. When you look at the size of the image that's on your computer screen or your tablet right now, you are looking at something that is probably 200 times the size of a normal iris. So just so you've got that. So first thing we have then is the osseous netting. Lots of it over here. This side is a bit blurry. We can't see it clearly. So certainly there are, this suggests a predisposition towards arthritis. And when we talk about arthritis, your head is already starting, your brain is starting to turn, right? You're getting the, well, we could work with this and this and this. We want to do these things with the diet, and that's exactly where your brain should go. Remember that at the age of 4, we also have time to do emotional work, right? There's always an emotional side to things. So because she's young, we have time to work with nutrition and emotional things to help prevent arthritis. When we look at the inner edge of the iris, so the edge where the pupil and the iris meet, it looks like someone took little teeny scissors and snipped, snipped, snipped it along the edge. We call this comb teeth. If you were with me a few weeks ago, we talked about digestion, and you'll remember that this kind of an edge to the iris, this comb teeth edge, suggests a predisposition towards inefficient digestion in the stomach. Now you already know that the stomach handles protein digestion. It prepares the proteins, it starts the process, and then the process is finished in the intestines. So when we see this, we know that we need to be supporting digestion. We also referenced a study a few weeks ago in one of these workshops where we talked, the study showed that in order to have strong bones, we need adequate protein. So we've got a couple of things going on here. This osseous netting, which suggests a predisposition towards arthritis, when combined with things that are showing up in the nutritive zone, which is what this zone is called, can turn this from an arthritis indicator to an osteoporosis predictor. Predictor is a strong word. It suggests an increased risk of osteoporosis at some point in time. Now, what we know about protein is that we need it to build our muscles, and that if we have good muscles, we are more likely to be active, and that strengthens our bones. We also know that bones are based on a protein matrix that the minerals are dropped into. And so if we don't have enough protein to build the muscles or to build the bone matrix, it doesn't matter what we do with calcium. It's not going to end up in the bones. If we see that the person's protein digestion is at a higher risk of being compromised, feeding them any amount of protein is not going to do any good, because they're not going to be able to digest it at the stomach. The stomach's not going to be able to start the process. So we want to make sure that as we see these things, that we keep all of this in mind so that we can be gearing our recommendations to what we need to do. Here is her right eye, and again, we can see lots of osseous netting coming down the side here. The other thing that we see here is what's called a sclera. You see this very dark band at the edge of the eye. And what this actually is, and it's exactly what it looks like, these fibers end before they get to the edge of the eye. Normally, the fibers should go right to the edge of the eye. The fibers end before they get to the edge here. This is the skin zone. We call this dark bandy sclera rim. You already know that the skin is your largest organ of elimination, right? And knowing that if the skin is not able to do its job, if it's not able to take care of eliminating the waste, and remember that sweat and urine have very similar compositions. If the skin can't handle that, what organs are going to struggle? What organs have to take the extra weight of that? Let's have you type that in. If the skin isn't working and can't handle getting rid of toxins, what organ is going to try to take those toxins and try to get rid of them? I know you know this. Type, 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 type. Oh, that is such a good guess, Rita. Not quite. It's not the liver. Good guess, though. The liver does a ton of detoxifying, so good guess. What is the other organ that handles, what's the organ that handles urine? We could say two organs, actually, because they're the Bobbsey twins. The kidneys, yeah, Rita, thank you. Good job. Thanks for weighing in on that one. So if the skin can't do its job and get rid of the sweat, that uric acid and fluid is sent back into the kidneys, and the kidneys have to pull it up, but they're already doing their full job. And the skin is the largest organ of elimination. How much pressure is that going to keep on those kidneys? And what is the kidney's ultimate job? What are they supposed to balance for us? Let's have you weigh in on this. What do the kidneys keep in balance? And it's not fluid, although they do that. There's something equally as important, if not more important. The kidneys balance your, something we sometimes measure if we do a dipstick test with urine. Uric acid, yeah, pH, yeah, absolutely, well done. Uric acid contributes to pH, so well done. So if the skin didn't get rid of the uric acid and it sends it back to the kidneys now have to handle that extra load. What does traditional Chinese medicine teach us about kidneys and bones? Now, none of you mentioned that you have pulse or tongue diagnosis under your belt, so I'll give you this one. I won't make you sweat it. TCM tells us that the kidneys and the bones are intricately connected. If the kidneys are struggling, the bones will be weak. So we can't let that happen to this cute little 4-year-old girl, can we? We've got to get in there and do some support. So what are we going to do with her? We're going to start asking questions. We saw that osseous netting. So I asked the mother, is there a personal or family history of arthritis? Yeah, the grandmas. Well, the grandmas are older. I'm not considering that much of a history. Is there a personal or family history of bone issues? Could include more bone breaks than usual. And there wasn't. Now, this little girl is very well fed. Her mother has been conscientious. She was a hard fought for child. The parents suffered infertility, ended up going to the fertility clinic and working with me simultaneously. They were successful, and the pregnancy was tenuous for most of the 9 months. So we fought hard to get this little girl here. So this child is given the best nutrition possible, and everything is really up to snuff. So I just reinforced with the mom that we should be considering not giving her so much dairy, that she needs a lot of leafy greens. We could introduce nuts and seeds. She's old enough to have nuts and seeds now. And we want to make sure she's getting enough protein. According to the study we cited a few weeks ago, 2 grams of protein for every kilogram of body weight per day. Get enough protein and make sure she's digesting it well. How do you know if someone's not digesting protein? What is the main symptom you're going to see if someone does not digest protein well? If you have an idea, let's have you raise your hand. Okay. Oh, Rita, I'm going to, if you've got a microphone, I'm hoping, I'm going to unmute your mic and you can tell us what is the symptom that you think shows up when they're not digesting protein. All right, your mic is open, Rita. Oh, maybe you don't know where your mic is. Your mic doesn't work. Okay, fair enough. So then type it in for me if you would please, Rita. What is the symptom? Okay, a child's not going to really understand what stomach over acid, and actually if their stomach's over acid, they will be digesting protein well because acid digests protein. So let me give you another hint here. It has to do with the gas they pass. Yeah, gas tells all. No secrets there. If they're passing just air and there's no odor to it, then they've just swallowed lots of air. If they're passing gas and they think, yeah, so that was a fart, no big deal, then that's a carbohydrate problem. If the gas they're passing is putrid, eye-watering, and room-clearing, that's a protein problem. So we can ask the mom then, as we're suggesting the protein, does this little girl have gas? And if the mom says, oh yeah, you ask her, how bad is it? Oh my stars, it's like, oh, you know, when she's passed gas, we have to go to the other room because, oh my goodness, wow, we have to give it 10 minutes to clear out. Then we know she's not digesting protein very well. So what would I suggest? And I wouldn't suggest all of these. These are on my thinking page. I'm writing down skeletal strength, which is a Nature's Sunshine calcium, magnesium, mineral formula. Krill oil, because vitamin K2 is as important for the bones as calcium and magnesium and phosphorus and all those other things, and boron. Vitamin D3 drops because we live in a place where in the winter, like right now, we have about 6 hours of decent daylight, and it's only barely decent because the sun is so low on the horizon. So I'm writing these ideas down, and I'm looking for more information. So I'm looking at the comb teeth then. And when I see the comb teeth, I'm going to ask, is there a personal or family history of problems digesting protein? And the mother says, oh yeah, bad gas. This child's only 4 years old. She may not be able to swallow a digestive tablet. So I can suggest to the mom, could you use more herbs, more culinary herbs in the foods? You know, things like rosemary and thyme and sage, dill. Those are all really great herbs for digestion. Ginger. Maybe you could incorporate more of those, not so much to really super flavor the food, because some of those flavors are fairly mature tastes, right? They're more for the adult palate. So just a little bit, just so there's some in there to support the digestion. But I could write down on my list of ideas for young children, catnip and fennel, because that's a liquid. For older children that can swallow tablets, it might be protein digestive aid, which is a hydrochloric acid supplement. And then I look at that scurf rim, and I'm going, wow, that's quite the scurf rim. Haven't seen one quite that pronounced in quite a while. So is there a family or personal history of skin problems? Well, she doesn't have any. Her skin's good, no family history of stuff. Her mom's actually a European-trained esthetician, so she would know if there was a skin problem. So things that we would write down on our possible suggestions list if we needed to: eliminate refined sugar, eliminate junk food, keep the protein balanced. And on our short list, we would list down vitamin A and D and nettle, which we can find in the Nature's Sunshine product called IX. So there was actually a study done that was published in the Journal of Advanced Research in November 2015 that suggests that vitamin D can be an important therapy for eczema, psoriasis, and acne, which is very, very interesting. So remember now that what we are doing, this is a 4-year-old child. Her mother brought her in for a totally different problem that was not related to skin, was not related to bones. But we need to remember at her age that what we are doing now is really more about preventing problems in the future. It's about keeping her well till she's 95, and God willing, she dies peacefully in her sleep, right? And things like this scurfrim could indicate, it does indicate a greater risk of developing eczema, psoriasis, or some other skin problem as she gets older. And of course, if she doesn't have eczema at this age, we're more likely to see, we'll more likely see something like an acne in her adolescent years, right? And we also want to be aware of the amount of stress that scurfrim puts on the kidneys to protect her from bone issues and arthritis as she gets older. So other things that we could consider, put on our possible list of recommendations, would be dry skin brushing. We could suggest doing an essential oil and oatmeal skin scrub if she had eczema or psoriasis. We could consider adding vitamin A with the vitamin D. And certainly zinc is a good, Bernadette, good suggestion. Zinc is another good thing. And that is actually in the skeletal strength if I was to decide to use skeletal strength with her. Again, with a young child, watch your dosing very carefully because zinc can really nauseate. And you might want to do it more as a zinc lozenge where it's a lower dose and the child could chew it easily. And so those are some other things that we could include in our recommendations here for skin. So overall on that first appointment, what I did, this is the first step in my therapeutic sequence, was I suggested less dairy overall. Adding kefir, I know kefir is a probiotic. It seems to be very well tolerated because of that fermentation process. And kefir is more solid for probiotics than yogurt is. Savory herbs for digestion and jacking up her vitamin D somewhat. Also suggested that maybe a little more protein, again, could be beneficial here in the long run. I didn't need to necessarily schedule a follow-up appointment with this little girl because I know her mother very well, and her mother will absolutely call me if she has any questions or concerns, so there's no problem with that. So we've seen here just a few of the hundreds of iris signs that are out there that you could learn about. And I'm hoping that you will join me on January 3rd. We're not done yet. We've still got quite a few slides to go. I'm working hard to get done by noon. And I'm going to ask you to take just a minute and nip over to one of these sites on January 3rd. I'm doing another one of these on blood sugar and related endocrine. So I'm going to give you just a minute to nip over if you want 10:30 a.m., 6 p.m. 10:30 is the time we started today. I don't know what time zone you're in. Or 6 p.m. Mountain. Jump over there. Get registered for that right away. And I'm just going to check this other comment while you're doing that. How about a fermented vegan protein powder? Absolutely. Absolutely. Turn that into a smoothie or something like that for the child. That would be an awesome, awesome thing to do if you can get the child to drink it. Yeah, and remember that when you're looking at those packages, the recipe on it for how to mix it is for an adult. For a 4-year-old, and most of them you're looking for 20 grams per serving for an adult. For a child, 5 grams, maybe 10, depending on how old the child is, right? So you want to kind of base it, the 20 grams per serving is based on 150-pound body weight, prorate it down, and mix your powder up accordingly. Okay, so hopefully that's given you a moment to jump over to one of these and get registered for the January 3rd webinar where we're going to talk about blood sugar and related endocrine. So read into that things about insulin resistance, right? I feel like I should be playing the Jeopardy music while you're doing that. Do, 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 do. Right, anyway, let's get on with it. All right, so what does it take to learn iridology? Because we certainly can't teach you everything in these free classes, right? Free classes, even if you attend every one I teach, you'd learn maybe 30% of what I know. And that's a good start, but it's not going to take you as far as I know you want to go. So in my humble opinion, it takes 40 hours to learn, have a good solid foundation. And I teach that in the form of 20 sessions, 2 hours each as live webinars. Each class is recorded in its entirety and posted to a student website. And so that means you can review it as you want. You have access to that site for 18 months, and I'm going to tell you why it's only 18 months. Also, every topic we cover has a short video produced about it. So if you attended the class, you got most of it, there's only one thing you need to review, you can click just that one thing and review that one thing. You don't have to listen to the whole 2 hours to find what you were looking for. At the end of 18 months, you are migrated from your student site to an alumni site where all the content is stored. That way, I'm not having to maintain that many different websites ongoing forever and ever. You get a digital textbook that is made available in weekly installments. Great images. We're on our 4th edit of it for clarity. We always want to make sure we're putting out the best. We always, in every class, review what we covered the previous week, give you a chance to clarify, ask questions, or just ask questions. You know, when you look at us, you think, oh, what does that mean? How does this work? So we give you time to do that in every class. We do a lot of in-class practice and interaction. With the course, I open the mics. So we talk freely back and forth. My students know to mute themselves if there's a dog barking, or one of my students has a wife who loves to sing, and she would often sing in the background. It was lovely, but we had to ask him to mute the mic when she was singing. You get a certificate of attendance for attending 80% of the classes live. Most of you probably belong to a professional organization like IONC, CanPro, CANNP, something like that, where you need upgrade hours. And this will likely count for your upgrade hours. Just make sure you get it approved first, because we will be incorporating nutrition. One of my students, this is how she felt about what she learned. Judith's teaching is professional and easy to learn as she stops for questions, has great slides, and reviews every week. Her students are her priority, and their understanding of the information is imperative to her. I would definitely recommend this course to anyone who's even thinking of taking an Iridology course. Judith is a wealth of knowledge and a fantastic mentor. I loved this course, and I know you will too. Allison actually came to me. She was just finishing her certified health practitioner course and was supposed to do an Iridology component, but they didn't have enough registrants to bring the teacher in from another province to teach the class. So it left the students up to finding their own Iridology component. Most of the students chose a correspondence course. Allison chose mine, and I'm so grateful that I got to know her through the class. She said as she would get together with her students as they were doing practicum hours on various things, that those students were complaining about they're not understanding, they couldn't get answers, nothing was settling for them. And Allison was not gloating, but was saying, you know, I don't have that problem. I've got a teacher, I've got a live teacher, I've got access to her through the Facebook page, I can ask questions. We've got Q&A sessions every month where I can ask questions, and so I get everything answered. And so the other students were kind of upset that they had decided to spend their money on a correspondence course and not on a live teacher course. In the Confident Nutritionist Dynamic Iridology course, we look at these eyes a lot. They have a lot going on in them. And we're going to look at them here now. This is a female, age 23. Here is her history, and I chuckle about her history only because she's my oldest daughter. And so I've been with her through all of her challenges, right? Not that it's particularly funny, but my goodness, she's accident prone. At the age of 4, she had a spiral fracture of her left fibula. So that's the large bone in the lower left leg. She fell from a toy in the playground, and as she fell, she twisted, and it did the spiral fracture. At the age of 9, she green stick fractured both arms in the exact moment she was doing a snowboarding lesson with school. She fell backwards. She didn't fall hard, but she fell at the angle that green sticked both of her wrists, both of her forearms, right? So she was in soft casts with both arms for 4 weeks. Most interesting. Now she's a dancer. She's a dance instructor. And she spends a lot of time in sweaty clothes at the dance studio, and it has made her very prone to fungal infections in her skin, particularly on her chest and her back. The fungal infection clears up in the summer when she's not teaching, and by about October, November, when she's been teaching for a couple of hours a night, again 4 or 5 nights a week, it all flares back up and she turns into an itchy, rashed mess. Looking at her right eye, we see again osseous netting. Can you see this coming down here? We see the comb teeth. Oh, does she ever have comb teeth? I could tell you stories about the genetics of this gut. Oh my goodness. And we see contraction furrows. Now, if Jensenians, you're thinking of these as nerve rings, we call them contraction furrows in constitutional. And so what these nerve rings tell us is that her nervous system sucks up her calcium and magnesium probably before her bones even have a chance to slurp up anything that they could possibly need. Looking at her left iris, again, lots of osseous netting all the way down and around. Comb teeth, contraction furrows. This eye adds to it some information at the collarette, which Jensenians, you will call this an autonomic nerve wreath probably. As we look at this and we see that we've got, in some places, 2 lines coming around, it tells us that her gut is prone to inflammation. The body uses calcium to calm inflammation down, to put out the acid of the inflammation. And so the fact that her gut tends to be inflamed means that her gut is demanding more calcium, but it's not demanding it to absorb, to put into the bloodstream, to put into the bones. It's demanding it to hold there, to calm down the inflammation. And that probably inhibits her ability to assimilate and absorb calcium well. So, osseous netting, we've seen these questions before. Is there a personal or family history of arthritis? In spades. On my side of the family, going back through my father and my grandmother, arthritis that is crippling. Fortunately, I've done enough to avoid it, and with any luck, she is doing enough to avoid it as well. Is there a personal or family history of bone issues? Could include more breaks than usual. You tell me if 3 breaks in her first 9 years of life counts. Again, we go to the same recommendations: low dairy, high leafy greens, nuts and seeds, protein, making sure she's getting enough protein, especially because she's very active, and the same dietary recommendations of skeletal strength, krill oil, and D3 drops. Again, that's on our thinking list. We're not telling her to do that yet because we haven't finished gathering information. She has the comb teeth. So is there a personal or family history of problems digesting protein? Oh my goodness, is there? Oh, her daddy, her siblings, her paternal great-grandfather had gut problems most of his life. And so we start simply savory herbs to enhance the digestion, but she's old enough to swallow pills. We could go into protein digestive aid as well to ensure that she is digesting properly and fully. Scurfrim, is there a personal or family history of skin problems? Well, she's got the fungal yeast in her skin. Bernadette, tahini, I'm thinking you're suggesting tahini for protein. Good suggestion. And of course, with that being from sesame seeds, you're going to pick up some good omega oils. So that's also a lovely suggestion for your protein. Calcium. Oh, you're suggesting it for calcium. Yes. Okay, good. Yes, that is a good suggestion for calcium. I love it when we can do the calcium in the food sources. Nicely done. Thank you so much. And when we've got the calcium with the omegas, that just helps all the more because the omegas help to make your hormones that you need to assimilate the calcium into your bones. So good suggestion. Well done. Again, on our list is thinking that we want to tell her about eliminating refined sugars and junk food and keeping her protein balanced. And vitamin A and D. Nettle from the IX for her skin. We could put on our suggestion list also Powdarco or Silverguard as topicals to help calm the symptoms down. We know that's not going to go deep and kill the fungus at the very root, that's got to come from the inside, but it will help if we can approach it from the inside and the outside. We'll get results faster. We have these contraction furrows. So is there a personal or family history of handling stress poorly or mental health issues? Oh yes, huge. So again, we want to eliminate refined foods, junk foods, keep the protein balance, and add lots of leafy green vegetables. right? We want to make sure that she's getting those minerals from the vegetables. So we might want to use skeletal strength. We might want to use a combination of herbs, hops, valerian, passion flower. They're very calcium and B vitamin rich, and that may help us address some issues here. So what kinds of things did I ultimately suggest for her? Now, she is my daughter. I see her lots, right? They only live a few minutes away. And so I can tweak her program on the fly as I need to. But her core program, this is what I have her doing as the base. Savory herbs for digestion. Easy enough to do. Protein digestive aid to make sure she's handling her protein. Dry skin brushing to help detox her skin from the outside. I've suggested that she take changes of clothing for between dance classes if she's sweaty. So she might go through 2 or 3 leotards and tight kinds of things, right? Fair enough. If she has to change after every class, she has to change. Lots of leafy greens and a vitamin A and D combination. A is so good for the skin, and so is D. And when we look at her sclera, we can see things going on here where the iris is genetic, the sclera is dynamic. The iris is what you inherit, the sclera is what you've done to yourself. And we've got lots of blood vessel activity here. And so when we understand the iris and the sclera, you can integrate all of your nutrition knowledge. You've been seeing how we can tie it in already. And thank you for playing in and weighing in on questions. You can integrate your herbal knowledge, integrate your lifestyle knowledge, prioritize which pieces of education and homework to share with your clients today, the next session, and the session after that. I like to give, when a client is new, I like to give them only 2 or 3 pieces of homework that I know are doable, and I save the rest back for the next sessions, the following sessions, because I want them to be massively successful and to feel like, yeah, they can do this. And the next time they're in, depending on how well they've done with that homework, if they've done really well, I'll add 1 or maybe 2 more changes. But I would never do a total about face. If they're drinking no water, I'm not going to tell them to start drinking 2 liters by tomorrow. If they're drinking 8 cups of coffee, I'm not going to tell them to cut all of that out by tomorrow. It's steps and stages. Get to 8 cups, we would say, let's have you drink 3 cups of water a day. They can do that. Fill a clear or a translucent water bottle that's 300 or 3 cups, 750 mils. Carry that with you. You've got to have it all gone by the time you go to bed, right? And if it's coffee and they're doing 8 cups, our first goal will be to get it down to 4 to 6 cups a day. We're teaching new habits. And we can easily create bite-sized and doable pieces of homework for our clients in our client sessions. We don't need to be doing time outside of that, unless they have a health condition that we want information on or that we need to understand. But putting the programs together should happen in session. Integrating iridology into your practice will help you to get rid of those lengthy intake forms. Throw it away right now. Know exactly which problems to address first and what the best recommendations are to start with and to build into. Significantly reduce doing research program design outside of client time. Yay! Free up some time. Stop overwhelming your clients with too much information while you're encouraging them to become long-term repeat clients. I have some clients that have been with me for 30 years now. I don't see them more than once a year. They don't need me more than once a year as a general rule by that stage. But they keep coming back because they know that I'm going to give them information that will be beneficial and that will be doable. And you'll look incredibly smart even if you feel insecure as you ask client-specific questions and create the programs right in your own session. That's exactly what Karen Choate found. She's one of my recent grads. Having recently completed the Confident Nutritionist program with Judith Kopp, I can honestly say this is one of the most rewarding, informational, and fun, I like that word, classes I've ever had. Judith keeps things light with a bit of humor, but above all, she's a master at her craft and generously shares her knowledge. Judith is committed to the success of her students. I don't tell them to say these things, but it's great that I've got more than one person saying it. I've already implemented several techniques and applied extremely crucial and beneficial knowledge with skills that I learned in this class to my own practice with great success. Thanks to Judith, I am definitely a much more confident nutritionist. Case number 3, a male age 20. I've just seen him once, just this last week actually, but he's a perfect candidate for our topic today because he has seasonal acne. It starts late fall and goes to early spring, which typically is late October till about the end of April, which is an awful long time to have a real mess of acne, primarily from the lips down and behind his ears and down the back of his jaw. So many of you know that some of those zones are liver zones and bowel zones, but it's interesting that this is seasonal acne. Notice that he has what we call a stomach ring. This suggests that he may genetically not his stomach may not be well programmed for digestion. Notice the expanded collarette. And notice the touch of the lipemic diathesis that is just in the early stages, and he's only 20. Let's talk about each of these individually now. The expanded collarette, this is the autonomic nervous wreath in Jensenian iridology, and it correlates to the tone of the intestinal tract, small and large. Right, so small is medial, large goes up, across, and down. So the question when we see a slightly expanded or an expanded collarette, or collarette that's not where we think it should be, is how many bowel movements you have each day and how much vegetable content is in your diet. Now, he said he typically has 2 bowel movements a day, so then we need to ask about bowel transit time. If he was to eat something like, say, some almonds and not chew them well, and watch for the bits to come through in his bowel movement, how long would it take? So if he ate a handful of almonds at 5 o'clock tonight, when does he see those chunks come through next? And his answer was 36 hours, day and a half. Not the right answer. So I'm thinking we maybe need to do some bowel support. So I write LBS down, should be LBS 2, and add vegetables on my list. Then I look at this lipemic diathesis. When we see the lipemic diathesis starting, if he was over 60 week up, not a problem, not to sweat it. But this suggests a family history of liver enzyme issues that can really mess up cholesterol and triglycerides. He's showing this and he's 20. It's obviously been there for more than a week, right? He's not going to dissolve this when he gets everything, all his ducks in a row. But there's an issue with his liver enzymes that's messing things up. So he said he's 20. I asked him, how much alcohol do you drink? His answer was that he gets drunk, minimum of 8 drinks at least once or twice a month. And he's been doing that since the age of 17. What kind of stress did that put on his liver? So the suggestions that I write down are reduce alcohol by half and add the Chinese formula from Nature Sunshine called Live C to support his liver. And then we get down to that scurfrin. His scurfrin is not anywhere near as bad as the little girl we saw at the very beginning, but in behind this bit of white fog that we see, there is a bit of a dark band. So the scurfrin is not a key player here. A little bit of a player, but not a key player. And we kind of knew that because the acne is seasonal. It's not year-round. We ask anyways, is there a personal or family history of skin problems? And no, there was not. So we write down on our notes, eliminate refined sugar, junk food, and keep the protein balanced. And we write down the skin recommendations of A&D, Nettle, Powdarco, and Silver Guard lotion. He also commented that he burns very easily, but he doesn't use sunscreen very often. So the recommendations that I came up with for him were, because this is a seasonal thing, and it seems to be that when he's in the sun in the summertime, it clears up his skin, which could be a bit of a bacterial thing in the skin. It could be a lot of things. It could be a lack of vitamin D. And so we suggested Live C, Super Omega 3, and Tanning Bed. And Bernadette suggests zinc could be it. Absolutely, zinc could be a part of the issue here because zinc is a prime skin issue, and she suggests doing the zinc tally test. So thank you for that, Bernadette. Really appreciate that. So we want to be looking at that. Again, part of the reason I didn't lean so far to the zinc, it's a great suggestion, was because this is seasonal. And his zinc component doesn't change in his diet. His diet is pretty consistent. So I did suggest doing a tanning bed for a few minutes per week to fake the sun, but not enough to get a tan. So just a few minutes, so his body thinks, oh yeah, got some sun, to see if that UV will work with this. So I've only seen him once, and I'm waiting to see how he's done with his homework for the next time we see him. And at that time, if the tanning bed and the Livesey and Super Omega have done their job, I'll leave it there. He can be on that for the very long term. If he's seen some improvement but not as much as he wants, then I will probably want to add some IX or some Powdarco lotion topically to his program. And the topical Powdarco would just be putting a drop on each blemish and just leaving it overnight, and that will tend to dry up the acne spots and help to heal the skin more thoroughly as well. So you're seeing that there is a ton of information to learn, and we are not even scraping the surface. To learn iridology in depth, we've got a course coming up. The Confident Nutritionist Dynamic Iridologist starts on January 17th, 2018. Space is limited to 10 students per class, and I'm going to be offering 2 classes, 2 sections, a morning and an evening class. Registration is open, and this is your registration link right here, iridology.education/confident-nutritionist-registration. So when is it? Again, January 17th, 2018, and it goes for 20 weeks. We take a couple of little 1-week reading weeks, so we finish late June. And again, the question often comes up, why do we not have a hard and fast date right here? That's because if we have 5 or fewer students in the class, we can really nicely cover all of the curriculum very thoroughly in 20 sessions. If the class group is between 5 and 10, we may need an extra week or 2 to cover all of the content in a way that I am happy with. Choice of 2 times, 11 a.m. to 1 p.m. Mountain Time, or 6 p.m. to 8 p.m. Mountain Time. When you register, you will be asked to commit to a time slot, whether morning or after or evening, and you don't get to flip between them based on how busy your day is. Remember that during this course of time, from January to June, daylight savings time does its funky thing. So I don't know how that affects you, but you'll want to make sure that you check and know how it will affect you. So what will you learn? How to create programs right in your sessions and eliminate your unpaid homework time. You'll learn how to do that base assessment in 5 minutes without lengthy intake paperwork. You'll learn how to ask questions that are relevant to your client's needs, only questions that are relevant to your client's needs. You'll learn how to prioritize the problems your client needs help with. You know, if we've got someone who's prone to osteoporosis, the first answer is not to throw calcium at the problem. The first answer is to make sure the gut's working right. When it is, then we can work with foods and supplements to make sure they're doing what they need to. And lifestyle, of course. You learn how to connect what you already know about nutrition and or herbology to what you discover using dynamic iridology. So some of you will notice that I use the terms constitutional and dynamic. Constitutional is the iridology portion. It doesn't actually include nutrition or herbs. When I add nutrition and herbs to it, I call it dynamic. So I'm teaching you how to integrate that. You will learn how to do a deeper assessment for more direction and understanding of your client's needs when that is needed. So you learn beginning to intermediate iridology, which gives you the ability to do an amazingly solid reading or analysis. You learn sclerology. You learn both of these at a level to prepare you for the IPA certification exam. If you choose to become certified, IPA does charge an additional fee for that. And you'll learn how to tie in your nutrition and herbology training, just as you've seen us do today, where we start shortlisting the recommendations that we want to make. And we also practice how to create the therapeutic sequences and priorities for your clients. Really beneficial in this if you've got some anatomy and physiology under your belt, because we assume that you do understand how the organs work, at least on a fundamental level. Now, we said in that last slide that it would prepare you for the IPA exam if you choose to do it. Why would you want to do that? Well, to have that professional, internationally recognized affiliation, to have the opportunities to keep up to date on the latest iridology research, to add your energy to the movement, to have iridology recognized by healthcare systems worldwide, and to demonstrate to your clients that you have been properly trained in the most current, valid, and accurate iridology assessment techniques. You know, Dr. Jensen laid such a fabulous foundation when he was teaching and practicing 40 and 50 and 60 years ago. Even his daughter-in-law, Ellen Tart Jensen, has said that much of what he was teaching we have now proven to be inaccurate. And it was simply because we have the technology now to do better longitudinal studies on people and things like that. So we've proven that some of the Jensenian stuff is not correct. Let's do another analysis here. Female, age 20, multiple food issues. This is going to be a quick little analysis, because this is where I'm going to show you that what you can see in 5 minutes or less. If someone's got a timer, go ahead and start it now. You see, because what I can see from here is that she's got blue eyes. That tells me she's prone to being over acid in her body. I'm going to have to work with her nutrition to help keep her acid in check, because that acid can lead to inflammation, pain, arthritis, all kinds of stuff, allergies, things like that. Then I notice she's got a lot of these petal shapes in her eyes. Each one of these individually is not important because there are so many of them. Collectively, they tell me she's creative, and they tell me that she is prone to endocrine imbalances, most particularly probably adrenal, thyroid, and pancreas. And because of where some of these are placed, I know pancreas/blood sugar is one of her #1 problems. Now, women who typically have menstrual pain often have blood sugar issues. Blood sugar issues mess up hormones. If hormones are messed up, we get menstrual problems, right? So we want to be aware of that connection. I look at her stomach. I see that she's got a bit of a gray edge, plus comb teeth, plus a stomach ring. I know I'm going to need to be working with her digestion and her food choices to make sure she can digest and assimilate her foods properly. I'm looking at also where we've got collections of lacuna. These are called lacuna. A single one here or there is, again, not quite as important, but when we've got a group of them, we're going to pay a little more attention if they're in a cluster. And so there we go. We've also got some of the fibers that are gluey, where it looks like they're kind of stuck together or they've got white glue over them. That speaks to inflammation as well. We haven't even touched the sclera. And I've already come up with how many things that we could work with. And because I understand those buzzwords and I understand how they interrelate, and that's what you will understand by the conclusion of our course, you can do an assessment just that quickly. You know what it means. You write those keywords down in your client notes. You know exactly where you're going. So once again, the course registration is now open if you want to get in there. Now, a little bit more about registering. Within 1 day of your payment being processed through PayPal, I will personally, haven't got things automated yet. I'm a high-touch kind of person. I will personally send you a form that you'll need to fill in and send back to me, and that's where you will designate whether you want the 11 a.m. or the 6 p.m. mountain class. Once I've received that back from you, within a few business days after that, I will set up a time to call you and chat. I want to get to know you a bit. I want to get to know who you are, what your training is, where you're headed, and how I can best support you in the learning environment. So again, super high touch. Now, we've heard from Karen Choate before, but she said this when she had completely finished her course. She's actually just working on her exams. Thank you, Judith. It's been such a pleasure studying under you and learning from you. I really miss our classes. I hear that a lot too. But I'm looking forward to completing this component of iridology and continuing my education, most hopefully with you. I am working on a what comes next course. I'm developing that now. I have begun to implement this incredible work in my practice quite successfully. It has truly helped immensely in my decisions and assessments. Thank you for sharing your skill, your knowledge, and your patience. So we've looked at mostly blue eyes today because they're the ones that it's easiest to see osseous netting in. You won't see osseous netting in a hazel eye or what we call a biliary eye or a brown eye because the pigment is too dense. But what can we see? We've got, again, that a bit of a gray blue. We've got some murky yellow, orangey stuff happening. We've got this bright flaming orange in here. We've got lots of dark lacuna here, which suggests lowered resiliency. We've got a nutritive zone that is dark and has lots of radial furrows going into it. Lots of requirements for support in that digestive tract. So, when we see this, again, we're going to be talking about digestion. We're going to talk about food choices and supplements to support digestion. We're going to talk about liver because of these colors. We're going to talk about pancreas because of these colors. We're going to talk about kidneys because of these colors. We're going to talk about lymphatics because of some of what we see here. We're also going to talk a little bit about blood fats because of what we see there. We're going to talk about liver because of this and kidneys because of this. We're going to talk about circulation and challenges with blood pressure because of this. Again, less than 5 minutes, and I've got the assessment done. I have an idea of where I need to start with, and I know what questions I need to ask. I'm going to ask questions about liver and kidneys and blood pressure, absolutely, and cholesterol levels. And I'm going to really focus my questioning on stomach. So when I create the program, then stomach and digestion, when I create the program, I'm going to take their shopping list, the things that they brought in and said, this is what I want help with. And I'm going to put that alongside what I've seen in their eyes. And I'm going to think quickly through the connections of how is what I'm seeing connected to what they want help with. How do I address these things that I know are critical to help them get the results they're looking for? So their goals are my goals. I'm just coming at it from the perspective of trying to find the root cause using the eyes. So everything we've looked at has been a lighter eye. Here's a darker eye. What can we see in a darker eye? Well, we cannot see osseous netting, that's for sure. We can certainly see the integrity of the collarette, which reflects on the nervous system and the intestinal system. We can see lots of lacuna type activity in other zones. We've got pigment, dark brown pigment showing up, which tells us we want to ask about liver. We've got contraction furrows. We're going to be asking about the nervous system. We've got a dark edge in here, quite a wide dark edge. So we're going to ask about stomach, digestion, acid, things like that. Here again, we've got lots of contraction furrows, lots of nervous system stuff needing support. We're going to ask about, and this actually reinforces the nervous system thing, when we combine radial furrows with contraction furrows, and this is a little different from what a Jensenian would teach probably. This augments this. So we know that the nervous system in this person needs massive support. We're looking at a high risk of allergies that have likely been undiagnosed and a bit of a lipemic diathesis. So we know we need to ask those liver questions. This is a fairly young person as well. It's a female in her late 30s, so that's awfully young to be showing a lipemic diathesis. So we have lots that we can see even in a dark brown eye if you happen to work with a lot of dark brown eyes. Now I like to pad things up. Your registration for your course includes $2,600 worth of bonuses. I gift each of my students with an IPA student membership worth $59 US, and I mentioned that's in US because this is Canadian and the conversion and blah, blah, blah. You get my Iridology cheat sheet, which isn't really a cheat sheet, it's a cheat booklet. It lists every iris sign you're going to learn, a description of what it looks like, what questions to ask, what dietary, what supplement, and what lifestyle suggestions to consider making. This is a booklet that is, we're just doing the final version. It's gone through several iterations, and it's going to turn out to be probably about 80 pages long. Private Facebook group just for my Confident Nutrition students and my alumni, where you can post questions, engage in discussion, and again, that's got to be worth at least $247 because you get access to that even after you've finished your program. Monthly student-driven coaching webinar. You submit cases, we talk about them. We help you work through your clients. Optional live IPA exam preparation. If you want to do the exam here in Calgary, you may. You can come here, and the day prior to a scheduled exam day, we do a one-day live review where we look at tons of eyes. We bring people in, you look at their eyes. If you're not in my student group, it's $300, and you don't have to be doing the exam. If you're in my group, if you've graduated and you just want to come for extra practice, it's open to you. It's open to all of my students and alumni. IPA requires that you do 10 cases, 10 analyses as part 1 of your exam, and that I get to mark those. So some teachers charge extra for this. Just letting you know, you pay for your course separately, and then you pay for this as a separate item. I include that as a bonus. I give you the 10 cases, the photos, the description of the person. You do the analyses, I mark them, and then we take 1 hour together where we review those, look for areas that you might need support. Then IPA provides me with a case study. This is part 2 of your exam. If you choose to do the exam, and they give it to me, I give it to you. When you finished it, you give it to me. I grade it with a fine-tooth comb, and then we spend an hour in private tutorial online going over your case, again, making sure you've got it down pat. And those are your bonuses. Those are your bonuses. Sorry, I clicked that a little quick. Why would you want to study with me? Because I've been where you are. I've taken a lot of classes from a lot of teachers where it wasn't the best investment. I didn't learn what I thought I should have. Didn't learn what I thought they were promising. But I also understand the financial and time constraints of running a business, taking care of a family, home, friends, and other important commitments. I understand that our learning needs are all different. We all don't learn in the same way. So I've got videos and written, lots of visual stuff. We've got tons of different ways to help you absorb the information. I understand that there's a lot to learn about iridology and sclerology, and it can be really overwhelming. So again, we've got lots of ways to help you learn it. And it's less expensive to study with a Canadian teacher who charges in Canadian dollars. So what is the tuition? It's $19.95 Canadian. For those of you who are in the US, when you pay, it goes through PayPal. PayPal or your credit card, or however you're going to run that through your PayPal, will convert it to US dollars for you. And you will find that it will probably come out with the exchange rate to between $13.95 and $14.95 US. Here's your registration link. Now, some of you might think, yeah, well, I could do this in 2-3-day weekends because there are some teachers that teach it that way as a level 1 and a level 2, and those courses are only $300 a piece. And that's a really great deal if you live in that city. If you don't live in that city and you've got to have transportation, you've got to have accommodation, you've got to have your meals, and you might even need childcare, there you go. You've just racked up the bill. You might even need to take time off work. What's that going to cost you? Where when you do this 2 hours a week, you've got time you can keep your day job. You don't have your hotel. You don't have transportation. It's all easy. The other thing I find, and you might find this too, is if I go to a 3, 4, 5, 6 day, some teachers just teach it as a 5 or a 6 day workshop. Whew, my brain doesn't work that way. I don't know if yours does or not. By the end of day 2, my brain is just soggy. I stop learning. My hand will keep taking notes for another day or two, and then by the time I get to day 5, I'm barely even listening. I'm certainly not taking notes. So many of us learn better in small installments, which is why the 2 hours once a week works so well for so many of us, right? And it means no time off. Now, and I know someone's asking, is there a payment plan? I really want to do this. The answer is yes, there is. Because not all of us have 19.95 Canadian in our back pocket, right? But 4 payments of $5.49. Now, if you're a member of IONC or CANNP, you want to look back in your newsletters to find the special links that I provided for you for registration so that you can make sure that you are getting what I promised you. I have a special offer for you, though. Again, Christmas is coming. Hopefully this helps a bit. Until Friday, December 15th at 8 p.m. Mountain Time, if you want to do the 4 payments, they will be 4 payments, 1 a month of $4.99 each. Now, that, when you do the math, comes out to being $2 more than paying the tuition in one spot. And you will, after December 15th, it's never, ever, ever going to go down that low until the class starts. So just be aware that that is available for you. IPA certification. Sorry, Rita, that you have to leave. I am probably cutting it really close here, aren't I, for the 12 o'clock. Thank you for joining us, and I hope you'll join us for the class. IPA certification exam is a $175 US. It's payable to IPA, not to me, but you don't pay it until you are ready to take the test. So that hopefully eases that burden. Some people don't need to certify, and that's fine. If you don't need to certify, don't. It's, you know, do what feels right for you. The benefits: no more unpaid homework time. Create your therapeutic sequences in your clients, help your clients to be more successful, and keep them coming back to you to continue their wellness journey. Eliminate those lengthy intake questionnaires. Develop that rapport with your client within minutes. And be more precise in your client work. One last student testimonial from Michelle Davies, who is just in her exam process. She's a graduate of holistic nutrition, but she was already certified in iridology from Darko Peirce and from Dr. Pesek. She said, after having all of that, this is the most amazing iridology course I've taken. Judith's course is top of my list. Judith's iridology course is very informative, descriptive, complete, as it contains the most accurate iridology, including sclerology, and most importantly, how to put it all together to make the proper assessment. And interesting that I just got these this week. Bill Caradonna was my iridology certification instructor. And he sent this to me this week, and it melted my heart. Bill and I have stayed in touch. I send him questions still. He answers them. He's a wonderful mentor. I looked up a Judith Kopp link for a YouTube video. Judith is wonderful, and ended up seeing all sorts of YouTube videos on iridology. He sent that to IPA. Couldn't believe it. And IPA's past president responded, as the IPA instructor coordinator, I'm sure you have heard me say, she sent this directly to me, that state that the importance of teaching true, authentic iridology. Thank you for stepping out there and representing core values that have proven research. So even IPA is appreciative and supportive of what we're doing here. So this is wonderful. It's time to get registered. Until Friday, December 15th, 8 p.m., you can take advantage of this special 4-pay price, maybe help you out with your Christmas budget a little bit. After that, it goes up to $5.49. The $19.95 tuition stays until the start of class. So I hope you will join me for the class, for the course, and I appreciate the time you've taken to be with me today. Have a wonderful day, and thank you so very much. Bye for now.